We routinely vaccinate children against a number of diseases, and now some countries are vaccinating children against COVID. In the US, millions of adolescents have already received it.
It feels good. Now I can meet with my friends and I won't have to worry so much about getting COVID.
And while that teenager was happy to go ahead, there are concerns. Here's one UK government advisor.
We want to be clear the reasons why we're immunising children. We need to be absolutely sure that the benefits to them and potentially to society far outweigh any risks.
Well, the US does sound sure. Here's the approval of the Pfizer jab for 12 to 15-year-olds. It says it's bringing us closer to returning to a sense of normalcy and to ending the pandemic. It couldn't be clearer. But for some, this isn't clear. There's concern about intergenerational unfairness. The Times columnist Ian Martin tweeted this week, vaccinating teenagers with a very new vaccine to safeguard oldies who won't take up the offer of the jab is troubling. Or there's this from the WHO.
Now some high-income countries are moving to vaccinate children and adolescents, while health workers, older people and other at-risk groups around the world remain unvaccinated. The consequences are clear to see.
But despite these reservations, this is happening. In June, Israel began giving the Pfizer jab to 12 to 15-year-olds. America, Canada and Germany are doing the same. France will start soon. In the UK, the regulator's given approval, but the government has yet to give the OK. And Pfizer's trial of over 2,000 adolescents who received its vaccine showed 100% efficacy and was well tolerated, or in other words, side effects were mild at worst. And there are several reasons these countries are choosing to do this. The first is to reduce transmission of COVID in schools.
The biggest benefit to children from immunisation would be in preventing school outbreaks. And we know that the Delta variant does seem to be spreading more easily among secondary schools.
We also know reducing transmission reduces the disruption to education, and it helps to reduce the transmission of new variants. President Biden's tweeted on this. The Delta variant is spreading rapidly among young people in the UK. If you're young and haven't got your shot yet, it really is time, he says. Transmission is one argument. Another is that while the vast majority of children who get COVID aren't ill, some do still need protecting.
We are seeing fairly severe disease in some of our older teenagers as well. And I think that we're seeing that a little bit more acutely now that a lot of adults have been vaccinated.
Primarily, though, this is about containing the virus and protecting those most at risk, such as older adults. The US pediatrics professor, Dr. Sarah Long, puts it this way. It's unlikely we could get community protection without immunising children. This is the linchpin to getting everything back to some kind of normalcy. Not everyone is convinced, though, it is the linchpin. And I'd highlight three reasons for this. The first is whether children are being vaccinated in part to make up for the fact some adults aren't. Listen to Professor Adam Finn, another UK government advisor.
There's clear evidence from Israel, for example, that by immunising a sufficiently high proportion of adults with the vaccine, you can actually eliminate the infection in children without immunising them at all.
Other scientists have picked up on similar points. This US public health professor argues if children are 25% of the population, you would either have to vaccinate every single last adult, or we have to also vaccinate the children. Which begs the question, should more be done to ensure all adults get vaccinated before children are involved? There's also a question about the vaccine's side effects. In a recent article, 3 ethics experts at the University of Oxford write, we have to weigh the benefits against vaccine side effects. So far, trials are reassuring, but those studies only gave the vaccine to about 3,000 young people. They are not large enough to identify rare events. But after millions of American children have now been vaccinated, regulators and Pfizer still say the vaccine can be used. The final question mark against vaccinating children right now is whether this is the best way to stop the pandemic. The children's charity UNICEF is clear on this.
At some point, no doubt, we will need to vaccinate under 18s. But the priority at this moment has to be making sure that all of the vulnerable and priority groups around the world get vaccines.
There does, though, appear to be a political reality here that national considerations will be put first. This is Tony Blair.
The priority will always be first to get your own country vaccinated, and we're doing that.
We'll see what the UK decides to do about vaccinating children, but even the prospect has drawn some criticism. Guardian columnist Gabby Hinsliff argues that to do this, Britain and other Western countries would be visibly choosing not to save lives overseas. The counter to this is that G7 countries are committing millions of dollars and vaccines to assist the rest of the world. However, every leader knows there aren't enough vaccines at the moment, and there's an inevitable tension between managing variants nationally and globally. Whether to vaccinate children is part of that equation, meaning in time, each country and each parent has a choice to make.